So let's get underway. It's taking a moment for my slide to advance here, so. Clint, do you know whether others can see the slides? I'm not seeing them yet. I'm getting a spinning circle representing kind of the waiting.
I think just Adobe is working on the on updating the screen. Just give it a few more seconds. Perhaps you can start with the introduction, Dan, and hopefully this thing will come up soon.
While that processes. So today I'm going to take you through a very famous historic re-identification event, which is the re-identification of the Governor William Weld. And the reason why this is important, even though it's been many years, almost 16 years since his re-identification back in 1997, is that the issues involved in his re-identification continue to pose a systematic challenge for re-identification even now. So it's useful then to go back and look at both what occurred with that re-identification attempt at the time, and then to go ahead and look at what would the current circumstances be with regard to re-identification of individuals using similar methods. Unfortunately, Fred, this does not appear to be resolving. I'm not sure what's happened here, because we did test the slides, I believe, earlier.
It's come up at my end. So
it's come up at okay. So if I advance the slide, do you now see the next slide?
Yes.
Okay. Unfortunately, I cannot see.
Okay. Well, maybe for folks, if they're having trouble, if you can move it from full screen and back again, that may help.
Okay. I've done that, and we actually tested this previously. So.
Yeah, I can't explain it.
Okay.
It's in a
so I think a good pattern, Fred, you're also able to move these slides forward,
yes,
right?
I am. Yeah.
Okay. So I'll look at these slides on my computer and then ask you to just please advance. So let's go to the first slide that starts with first some history.
Okay.
So I'm going to take you back in time to May 18th, 1996. Massachusetts Governor William Weld is about to receive an honorary degree and give a keynote graduation address. Unbeknownst to him, he instead ends up making a very critical contribution to the privacy of your health information. It's not what he said that ends up protecting your health information, but rather what he did. Weld unfortunately teetered, collapsed unconscious on the stage in front of a shocked audience. Now, the story might have stopped here, but others stepped forward and helped this to become an influential event in U.S. public policy for protecting health privacy. The local television outlets ran and reran video of Weld's collapse, and the newspapers also reported in some great detail the time of his hospitalization, the tests, procedures, and his diagnoses, which are all information that would be routinely recorded as part of paying Weld's insurance bill. I won't read this entire news article to you. It's available in the appendix of the paper that I'm talking about today. But you can see that, for example, the news includes details, for example, like his age, exactly what tests were performed on him, when he went into the hospital, how long he was there. So Weld recovered quickly, and months passed, and this whole incident might have been quickly forgotten. But a MIT graduate student who was studying computational disclosure control had her attention turned towards hospital data that was being released by the Massachusetts Group Insurance Commission, or GIC, and it was being released for the purpose of improving health care and controlling costs. Now, Paul Ohm, who is now a senior privacy advisor for the Federal Trade Commission and a law professor, wrote a very interesting paper called Broken Promises of Privacy, where he details the Weld re-identification attack. So Weld had assured the public that the GIC had protected patient privacy by deleting identifiers. And the graduate student started hunting for the governor's hospital records in the GIC data. She knew already that Weld resided, according to Ohm, that he resided in Cambridge, a city of 54,000 residents, as reported by Ohm. For $20, she purchased a complete voter roll from the city of Cambridge, which contained the name, address, zip code, birth date, and sex of every voter. And by combining this data with the GIC records, she found Governor Weld with ease. 6 people shared his birth dates. Only 3 of them were men. Only he lived in his zip code. And then she sent the governor's health records to his office, which included diagnoses and prescriptions. So this, of course, probably drew quite a bit of attention, at least from Governor Weld, but it also drew much broader attention in the general public as this hit the press. Now, here's a need for a reality check, though. You'll note that Ohm reports that there were 54,000 people in the population register, but if we look at the census data for 1990 and for 2000, you'll see that in 1990 we had 95,000 individuals in Cambridge, Mass., and in 2000 we had 101,000 individuals. If we use some linear interpolation just to get a ballpark estimate of how many people resided there, there were approximately 99,435 people for roughly 100,000 individuals. So it turns out that almost half of the Cambridge population could not have possibly been re-identified using the voter registration laws. The essential, I'm going to pause here from the Weld story just to give you a little bit of background and some essential re-identification concepts. Those include the idea of record linkage, linkage keys or quasi-identifiers, and sample uniques and population uniques. So the idea of record linkage is fairly straightforward. We have a data set that has been stripped of the obvious identifiers like name and address, and perhaps contains healthcare information like diagnosis codes or procedure codes. Along with that, it contains variables like gender or age. And by linking 2 data sets, one a population register, perhaps a voter registration list, to the unidentified healthcare information, we can re-identify the individuals in the data set when the gender, age, and other variables match. These matching variables are called quasi-identifiers. On their own, they wouldn't be sufficient to result in someone's identification, but in combination, they may uniquely identify a single person. When that's the case, a match is possible. The other concept to bring forward is that of the key resolution. So, for example, in this slide, you'll see full date of birth or geography. A full date of birth, of course, there are 365 days in the year. People might live to be 100 years old. There are potentially as many as 36,000 potential categories one could fall into. For geography, this might range anything from states, where we would have only 50 categories, to 5-digit zip codes, where we have approximately 43,000 categories. So the higher our resolution, the more likely someone is to be unique with regard to those characteristics. Now we need to address the issue of sample and population uniques. When someone's the only person in a particular data set with a set of characteristics, combined characteristics, we call that individual sample unique. The sample data set, which is the data set we're trying to re-identify, only contains one person with those set of combined characteristics. if that person is also unique in the larger population, so if we go out to the general public and that person is the only person sharing those set of characteristics, we would then call that person a population unique. When we're trying to measure disclosure risks, what we want to do is look at how many of the sample records are indeed sample uniques, and out of a larger population, how many of these would match to unique individuals in the larger population. So let's take a look at these linkage risks. Obviously, if you are not in the sample, you aren't at any risk of being re-identified. Reading off the lower right-hand corner here. Records that are not unique in the sample, of course, can't be re-identified. I'm reading off the lower left-hand corner here. So records that are not unique in the sample can't be unique in the population. They aren't at a definitive risk of being re-identified. Records that are unique in the sample, there's only one occurrence in the sample, but there are multiple individuals in the larger population, can't be definitively re-identified. They have only a probability of being identified with further work. And the only those records that are both unique in the sample and in the population are at a clear risk of being identified with exact linkage. So it's fairly easy in any particular data set to determine how many individuals are unique with regard to a set of characteristics. And then for many characteristics, the likelihood of being unique in the larger population can be estimated from statistical models that are built, for example, off the U.S. Census data. Let's turn our attention back to the Weld-Cambridge attack. We've got approximately 100,000 individuals, of which about 13,000 are under the voting age and therefore wouldn't be on the voters list. Of those individuals who are at the voters of voting age, we can use a simple probability model called the pigeonhole principle method, and we can determine how many of those individuals are likely to be unique with regard to their characteristics. So if we take, for example, within a 5-digit zip code and gender the number of individuals, we can figure out how many individuals are going to fall within that group of individuals of a particular year of birth into a unique day of the year. And so based on that, we're able to at least approximately estimate that we're going to have almost a reduction of 50% based on individuals not being unique with regard to their characteristics. Then furthermore, we have to realize that a lot of these uniques are not going to be registered to vote, so they need to be removed. And we end up with approximately 30,000 individuals, maybe 29,000 individuals, who are at risk for possible re-identification. And we need to note that this is only risk for possible re-identification because some of the individuals who appear to be unique here in reality are not unique because the other individuals who share characteristics with them are not registered to vote. So let's look at the issue of how typical Weld's re-identification was. Weld was extremely easy to re-identify for a number of reasons. He was a state employee as the governor. He was publicly known to have been hospitalized because of his collapse, so you could count on his being inside the GIC hospital data set. Note that this kind of foreknowledge would not likely exist for any kind of random re-identification target who is unknown to an imagined data intruder. We use the term data intruder in this field to describe someone who's attempting re-identification. So for a randomly selected target, the data intruder would be unlikely to know whether the chance target individual was a state employee or had been recently hospitalized. Weld was also sure to have been registered to vote. He was likely involved in photo ops as the governor casting his vote, and he was publicly known to reside in Cambridge, so he could be counted on to be found in the Cambridge voter registration list. This foreknowledge of this would also not be typical for a random re-identification target. Let's look at the next slide. Note here that re-identification failure and successes are listed out here, but I've only listed those cases where one or two persons with the shared quasi-identifier characteristics exist in either the healthcare or the voter registration list. So obviously, if you're not in the hospital data, you can't be re-identified. If you're not in the voter data, you can't be re-identified. If there are two individuals in the hospital data set that share the same characteristics, you can't be definitively re-identified. There's not going to be a one-to-one match. And likewise, in row 4, if there's only one individual in the hospital data set but two people in the voter registration list, you have at best a 50% chance of being re-identified. We also have this issue, excuse me, though, of non-voters. And so in some cases where we believe we have a re-identification because we have one individual in the hospital data set and one individual in the voter data set, there may be another individual who is a non-voter and might be the actual match. So we have only a 50% chance of being correct that we've re-identified that individual when we match to an imperfect population register. So the row 6 shows where the condition where we have a correct re-identification, a true one-to-one situation. This situation I call the myth of the perfect population register. I do that as a nod to Paul Ohm, who wrote another great paper, which is called The Myth of the Super User, and describes some important public policy considerations to take into account when we're trying to assess the potential impact of, say, computer hackers who have perhaps astonishing skills, but there aren't a large number of people who share those kind of skills. So the myth of the perfect population register, we can see in row 5 that not every person who isn't in the voter registration list is, of course, directly protected from re-identification. But their absence in the population register also reduces the probability that others who share their quasi-identifier set can be correctly re-identified. And this is an extremely important limitation on re-identification when imperfect population registers are used to attempt re-identification. The critical part of many re-identification efforts, which is often assumed by disclosure scientists, is this assumption that we have a perfect population register. But in fact, if we're using voter registration lists, nationwide about 70% of the voting age population is registered to vote, so that leaves about 30% unregistered. All population registers, of course, are going to have data errors and be incomplete to some extent. And we may spend more to try and create a more accurate population register, but we will always face the challenge that it's hard to keep a population register current for a particular point in time. It's also worth pointing out that some types of data errors are much more critical than others. For example, anyone who's not in the population register can't be re-identified themselves, but they also indirectly reduce the probability of correct re-identification for others. So if only one person with a quasi-identifier set is missing from the population register, then the probability of correct re-identification drops to 50%. If we have two people in that category of combined variables who are missing, then the probability of a correct re-identification for that category drops to 33%, and so on. Without the important advantage of this public information that was available regarding Weld's hospitalization, a data intruder would have had to go through the daunting process of trying to confirm that Weld was the only 50-year-old male in his zip code 02138 at the time of his collapse with his birthday. There were approximately 35,000 persons living in zip code 02138 in 1997. It's difficult to imagine how a lone data intruder would have had the ability to complete this essential step of the re-identification process. Now, we have a little bit of help that we can get from the 2000 and the 1990 census data. We can examine those to look at how many 50-year-old males are in zip code 02138. We did a fair amount of modeling on this under a number of assumptions, and from those data sources, it appears that there's approximately between 175 to 150 individuals who are likely to have been within that zip code at the time. So based on this, we can use the pigeonhole probability principle again, and we can determine for the range of 150 to 175 individuals, what's the probability that someone is, that Weld would end up being unique with regard to his birthday. It turns out that there's somewhere between a 66% and a 62% probability that he could be re-identified using the voter registration list. So that's about a 35% chance that the alleged re-identification was incorrect. Most people who have heard the Weld story, and that's been repeated many times in blogs, the Paul Ohm piece was extremely popular and was repeated. It is still repeated even as recent as last week. I was still seeing new reporting of this in the press or in blogs. And people reading that Weld was re-identified using voter data are likely to assume that this re-identification was made with certainty. So even if we take Weld's quote re-identification as a probabilistic statement, a 35% chance for error greatly exceeds the usual p-value standards for scientific evidence. And it also begs a fairly important question: how should we define re-identification if we don't mean it to be with certainty? Without the news coverage regarding Weld's public collapse and hospitalization, this might never have become the touchstone for privacy reform that it did become. It's really quite difficult to overstate the influence of the Weld-Cambridge voter list attack on U.S. privacy policy. It clearly had an impact on the development of the de-identification provisions within the HIPAA privacy rule. And it has also served as an important illustration of privacy risks that were not adequately controlled prior to the implementation of the HIPAA privacy rule. It's now clearly understood that simple combinations of high-resolution variables like birth dates and zip codes put an unacceptable proportion of the population at risk for potential re-identification. The lesson that we've learned from this is that we must pay attention to the potential for re-identification when data has only been stripped of the directly identifying information, such as names and addresses. But I would suggest that there's still a lesson yet to be learned, and that is that this perfect population register, which is the Achilles heel of the Weld attack, actually limits and underlies many, if not most, of the re-identification risk estimates that are made by statistical disclosure risk scientists. Creating a perfect population register that is complete and accurate is a tremendous challenge even for the Census Bureau, and it would typically be far beyond the likely abilities of a hypothetical data intruder. The disclosure risk scientists themselves usually can't afford to complete this final exhaustive step, so when they make re-identification risk estimates, they wisely skip the last essential task and instead make an easily obtained but highly conservative estimate of the true re-identification risks. That's a perfectly appropriate practice as long as everyone who interprets the results understands that we've left out the hardest part of the equation, and we've chosen to err strongly on the side of caution so as to protect privacy. It has to be recognized, though, that missing and incorrect data will inevitably plague any attempt to build a perfect population register, and to the extent that the population register is imperfect, significant proportions of the purported re-identification matches may be simply incorrect. We also have to note that data divergence is going to be a continual challenge in the construction of perfect population registers. Many variables that might be used for matching have time dynamics, like changing zip codes when people move, their changes in their marital status, their income levels, etc. And we have problems of missing or incomplete data that are pervasive in data sets. As well, we may just have simple keystroke or other coding errors. We can overcome some of these using probabilistic record linkage methods, but these are always subject to uncertainty, and a data intruder is never really certain that the correct people have been re-identified. And more importantly, in the real world, they're seldom even able to check out the accuracy of their methods. So, unfortunately, we've covered how things were. Fortunately, HHS responded appropriately to the concerns raised by the Weld-Cambridge voter list attack. But that was then, and this is now. So the HIPAA safe harbor de-identification provision now restricts disclosure of, for example, full dates of birth. Only the year can be reported. Ages above 90 years cannot be reported, and 3-digit zip codes cannot be reported, or 5-digit zip codes cannot be reported. You can report 3-digit zip codes if the populations are larger than 20,000 persons. So let's look at how the Weld voter list attack would play out under today's HIPAA protections. The data intruder would only be capable of linking 50-year-old males within a 3-digit zip code, in this case 021, between the hospital data and the voters list. Even if Weld was the only person who held these combined characteristics, which is a lot less likely now that we've done this collapsing, he would be among 7,299 other persons who shared the same characteristics in his zip code. Even if the data intruder could overtake the overwhelming efforts needed to determine which of those 7,300-some 50-year-old males in that zip code linked to the unique hospital record, in order to verify that it was a correct re-identification, he would still have to have a population of 1.25 million people in which it would be necessary to confirm there was not at least one other 50-year-old male who had not registered to vote. Now, Weld was had a bullseye on him in this particular re-identification attack. For example, had the graduate student attempted to re-identify the 20-year-old males in Cambridge, where we have both MIT and Harvard, the probability of a correct re-identification would have been only 6%, even with the full date of birth and the zip code included. But it's a bad idea to argue policy from specific examples. We need to be more broad. So let's expand out to the entire Cambridge population. If somehow a data intruder could construct a perfect population register for the 1.25 million people living in that 3-digit zip code of 021, no unique combinations of birth year, gender, and zip code existed either in the 2000 or the 2010 census data when the safe harbor de-identification standards are used. Now, there's some effect there from the census's own disclosure control efforts, but it's quite clear that this re-identification risk has been reduced to the point where we can no longer reliably detect or measure it. To go on further, studies by Benitez and Malin looking at the safe harbor de-identification protections at the state level show that at least 400 to 1,000 times, that it's 400 to 1,000 times more protective than permitting direct PHI access or protected health information access. So compared to having direct identifiers, this is not 10 times better. It's 400 to 1,000 times better, even when taken at a state-by-state level. We can add to this the recent 2011 study by the Office of the National Coordinator at HHS for Health IT, where they found 2 re-identifications in 15,000. The reference for this study is in my paper. The reference for that is at the end of the slide deck here, in case you want to follow up on that. But it's an extremely important study because it was rigorous. It used commercially available data to try and build a comprehensive population register. It paid the expense of getting that commercial data, and the results were validated, which is something that, as I mentioned, rarely occurs in many re-identification studies to confirm that you have correct re-identifications. I should also point out that there's another method besides safe harbor called statistical de-identification, and this works well because it is flexible and helps to balance the important competing goals of privacy protection while preserving the utility and statistical accuracy of de-identified data. Why does this matter? Well, there's a great societal value to de-identified data. It's really a public good that drives a lot of societally important improvements. And it's the engine that drives a number of innumerable essential health systems improvements, things like quality improvement, health systems planning, medical and public health research, for example, comparative effectiveness research, adverse drug event monitoring, patient safety improvements, and reducing health disparities. This kind of data greatly benefits our society, and de-identification provides strong privacy protections for the individuals from whom this data is derived. And the promise of future electronic health records or electronic medical records and health IT is yielding richer de-identified clinical data, and it will form the basis for the progress in healthcare reform that will occur in the future. An important misconception about de-identified data is the idea that it doesn't work. Paul Ohm had alleged in his Broken Promises of Privacy paper that indeed it was easy, cheap, and powerful to perform re-identification. And that was certainly true pre-HIPAA, when just a 5-digit zip code, birth date, and gender have been shown to be able to re-identify between 87 to 63% of the U.S. population. The reality now, though, is that under HIPAA-compliant de-identification, safe harbor re-identification risks have been more recently estimated to be approximately 4 in 10,000. So under the current HIPAA requirements, re-identification is expensive, it's time-consuming to conduct, it requires some serious computer and mathematical skills, it's rarely successful when it's properly done, and finally the results are uncertain as to whether it has actually succeeded in most cases. Another misconception would be the idea that de-identification works perfectly and permanently. Perfect de-identification isn't possible. De-identifying doesn't free data from all possible subsequent privacy concerns, and it's never permanently de-identified. There may be changes in availability of data that could change re-identification risks in the future. One important thing to note is that another way that it's not perfect is that simply collapsing your coding categories until you've made the data K anonymous, or you've assured that there are at least K individuals, 2 individuals, or 10 individuals who share the same characteristics, can make the data unsuitable to many statistical analyses. So there's an inconvenient truth about data privacy. We can't have our cake and eat it too. We can either have complete protection, which means no data at all, or we can have high information, which may have poor privacy protection. Fortunately, there's a trade-off that can be had, and there's been some talk by some disclosure scientists that, for example, they can always find a sweet spot. And I want to point out that that sweet spot is mathematically constrained. The sweet spot is probably this green circle that I put on that trade-off line. It's certainly not the ideal situation where you can have both perfect information and perfect protection. That, unfortunately, is not achievable due to mathematical constraints. So successful solutions in de-identification appropriately balance disclosure risk and statistical accuracy. They protect and balance these two vitally important societal interests, protecting the privacy of individuals and preserving the utility and accuracy of statistical analyses. Without this balancing, we can rapidly head, when we over de-identify, we can rapidly head in a direction of bad science and making bad decisions because we've destroyed the statistical accuracy of the data. Appropriate disclosure control methods result in small information losses while substantially reducing identifiability. Some very popular de-identification methods like k-anonymity can unnecessarily and even more importantly, often undetectably degrade the accuracy of de-identified data for multivariate statistical analyses or data mining. This occurs because they distort variance-covariance matrices and they mask heterogeneous subgroups that have been collapsed into generalization protections. This is something that statisticians understand well, and computer scientists usually, but it's not well recognized and integrated within public policy yet. Poorly conducted de-identification quickly leads us to bad science and bad decisions. We should also note that it's important to look at the issue of data intrusion scenarios. The total probability of re-identification is the probability of being re-identified given that there was an attempt, okay, and the probability, or being able to be re-identified given that there was an attempt, and the probability that there would be an attempt to re-identify at all. And of course, these are not likely to be independent. The higher your re-identification probabilities, the more likely someone is to attempt re-identification. So the idea that we greatly reduce re-identification probabilities in the first place, if you only have a 4 in 1 in 10,000 chance of re-identifying individuals in the first place, it becomes unlikely that people are going to even try to exert the effort in a re-identification attempt. There's some great work by Mark Elliott and George Duncan that helps frame data intrusion scenarios, and I refer all of you to that, where we frame the probability of attempt in terms of the motivation, the resources, data access, the various attack methods, the quasi-identifier properties and sets, data divergence issues, and the probability of success, the consequences of that success, and the alternatives for achieving the same goals. 3 main data intrusion scenarios are important to understand. One is the idea of a nosy neighbor attack, where we're looking for a particular individual in the data set. Alternatively, there might be marketing attacks, where we want as many re-identifications as possible, but we don't care who we re-identify. And then finally, demonstration attacks simply want to show that re-identification is possible, either to discredit the practice of de-identification or to harm the holder of the data by showing that people could be re-identified. I would suggest that an important provision that does not currently exist is that there needs to be a prohibition, or at least it doesn't exist as regulation. There needs to be a prohibition on re-identification. We should, at a minimum, contractually hold people who are receiving de-identified data to not re-identify, attempt to re-identify, or allow to be re-identified any patients or individuals in the data or their relatives, family, or household members. I've got a fairly lengthy section in my paper with regard to other recommendations, but I'll skip through this for the moment and move on, and you can go back and pick those up in the paper if you're interested. So what are our lessons learned? Well, I think we have some essential lessons learned from this critical re-examination of the Weld re-identification attack, and I would propose that they are these. Did Weld's re-identification have a useful and important impact on improving healthcare privacy? Yes, I think that's quite clearly the case. Has this event led to important regulations that help to importantly protect patients from re-identification? Undoubtedly. Does the Weld saga realistically reflect privacy risks that exist under the HIPAA privacy rules today? No, not at all. And I'd even suggest that perhaps the continued circulation of this story has moved from being a useful public policy motivator now at this point into the realm of being urban myth. Should we let the minimal risks of re-identification under today's HIPAA protections cause us to abandon the use of de-identified data, which can help save lives and improve our healthcare system? No, not at all. Not unless we wish to abandon science and progress in favor of our irrational fears. So at that point, I think we're probably ready to take questions. I unfortunately can't see the questions, so I'll have Khaled read those off, and then I'll respond to any questions that anyone has.
Great. Thank you very much, Dan. So for the attendees, if you can type your questions for Dan in the text box that should be on your screen now, and I'll read them out as they come in. While we're waiting, I'll make one comment and ask one question, Dan. The comment is, we did analyze the 2010 census and looked at the safe harbor compliant data sets, and we did not find any uniques in there anymore. So I think safe harbor in 2010 will, based on the census data, would not identify any unique individuals, which is a shift from the analysis that was done with previous census data.
The fact, though, that the 2000 data also did not show that, when there were population uniques listed, and the data swapping methods would not have moved those individuals great distances, I think led to some assurance. But your point is well taken about the 2010 data. Go ahead, I cut you off.
Oh, no. So my question was, as I was discussing the results in your paper with some colleagues in the disclosure control community, some of them mentioned that a 65% re-identification probability is still quite high for the Governor Weld re-identification attack by the normal standards that are used in the disclosure control community.
Well, I think that leads to a really interesting conversation that the disclosure control community has to have. What should we call re-identification? When people read about this in the press, I think they believe that the person is definitively re-identified. And I'm willing to buy that something that creates a high level of confidence is probably also damaging. So what standard should we have? And I think we also have to be careful about who we're communicating to about those re-identification risks. For example, because someone might be harmed even by an incorrect re-identification, I think it would make sense to label and define re-identification as linking any direct identifiers back to an individual regardless of whether it's correct. However, if we're reporting these results in the literature to be interpreted by policy makers, I think it's quite important that we distinguish between whether re-identification is certain or not, because as these get reported and processed both by policymakers and in the general public, those are read as if those are real risks of re-identification, when in fact re-identification may not even be attempted. If it is attempted, it may indeed be an error.
Okay, so we have one question that just came in, and I'll read it out to you. So for organizations faced with requests for disclosure of data, is it enough to simply remove the 18 HIPAA identifiers in order to establish that a data set is sufficiently de-identified? Or is it necessary to do a more complex assessment of the data to be disclosed in order to know that the protection is sufficient?
Well, I would say this. You can be safe harbor compliant by removing the 18 identifiers. And so you've met your obligations with regard to the regulation as it exists today. I would say there's still need for some small improvements in the safe harbor regulations. For example, if a zip code is a three-digit zip code has less than 20,000 individuals, you're required to recode that to 000. If you do that, but you're also reporting information that leads to the location of the providers for individuals, it is, for example, here in New York City, where you have zip code 102 is in Battery Park City on the tip of Manhattan. There are 8,000 individuals there in 2000. That's required to be recoded, or at least was then. And so that would be recoded as 000. But if you have a pharmacy or a physician or a hospital visit with a zip code, a three-digit zip code of 100, it's going to be quite likely that that individual whose location is coded 000 actually resides in Manhattan. And so there are need for some small fixes. So it's useful to get advice from experts with regard to good implementation of Safe Harbor. But you can meet the current regulations by removing those 18 types of identifiers as specified.
Okay. The next question is, it seems to me that the assessment of re-identification risk needs to consider your trust in the individual or organization to whom you are releasing the information, and the contractual or other agreements you might be able to put in place. You touched on this towards the end of your presentation, but can you elaborate on this issue?
Yeah, I quite clearly I feel that that's the case. We can help control the probability that re-identification will even be attempted, and we can provide ourselves with opportunity for recourse if that turns out to be the case by contractually prohibiting re-identification and putting other controls on who has access to that data and the purposes for which it can be used. I would like to see HHS in their forthcoming de-identification guidance make some of those requirements applied to de-identified data, but I think it's only in any organization's best interest to impose those kind of controls as well. And you'll see in my paper and in my other public presentations recommendations that I've made for terms of agreement that I think are wise to routinely use with de-identified data.
Okay, the next question. Do you believe that the requirement suggested in the recent FTC privacy report that companies must publicly promise not to re-identify data and contractually ensure that future companies do not attempt to re-identify data can be enough to ensure that individuals will not be re-identified? This is similar to a re-identification prohibition.
Yeah, I think that was a pretty wise direction for the FTC to turn and head in. I believe in and of itself, it perhaps might not be sufficient because you want to make sure that the re-identification risks are small in the first place so that there's not a lot of temptation to attempt re-identification. But I think if data has been properly de-identified, then the idea that companies that have internal policies and procedures that prohibit the re-identification of data and that they flow that downstream to anyone who contractually flow that downstream to anyone to whom they release data, that I believe that's an appropriate form of control.
Okay, the next question. I appreciate that research with de-identified data goes a long way towards resolving privacy concerns. However, sometimes individually identifying data is necessary for certain types of research. What types of controls do you think are best for studies with individually identifying data?
Well, I would refer, back to the conditions that are imposed because this is actually a regulated area. In the United States, the common rule would cover data that is individually identified and used in research. There's some debate about whether there should be changes to the common rule. There was a notice of advanced rulemaking which had comments requested for it. I'm more focused on the issue of de-identified data, so I'll leave that to people who work in the realm of what the requirements of the common rule are.
Okay, the next question. Thank you for a very useful overview of this identification problem and approach. The pigeonhole principle seems to define the problem as one where sequential dataset queries are not possible. Is an implicit assumption of this approach to de-identification, risk quantification, that dataset queries by the user are not possible?
Well, here we're looking as if all these identifiers are available at the same time and looking for uniqueness with regard to the characteristics. But you've raised an important question here. People have demonstrated, for example, that if we have a restricted query system that is going to try and prohibit responses to queries that can reduce privacy, that indeed it's possible to game those systems into a state where they can no longer reply. And there's some great work in this area that's already been done. I'm, as a epidemiologist, I don't spend a lot of time focusing on those kind of query systems because I usually need the entire data set to be available together in order to perform statistical analyses on it. So my knowledge of these query-based approaches is not real detailed, and I'll leave it at that.
Okay. So we don't have any other questions in the queue, but we still have a few more minutes. So if it's okay with you, Dan, I'll just ask a couple of follow-up questions to those that came from the attendees. The first one was just going back to safe harbor, and the problem we've encountered has to do with longitudinal data. So it is possible to create longitudinal data sets that meet the requirements of safe harbor, but by even using the uniqueness metrics, the population uniqueness for those data sets can be quite high. So what's your view on this? Even though it meets the requirements of safe harbor, we know that the risk is high, especially when we're talking about longitudinal data sets.
Well, I think it really depends on the issue of whether the information required to the longitudinal quasi-identifiers are reasonably available. And so the problem with safe harbor is it puts no additional conditions on the distribution of that data. And in circumstances where those longitudinal quasi-identifiers are reasonably available, then I think safe harbor falls short. In a lot of situations, for example, even the process of following where someone has moved over time, you can use the change of address information that's available and purchasable, for example, to determine people's locations over time. But technically, it's a very complicated thing to try and track those longitudinal changes for a large number of individuals at any point in time, and it's very expensive. So whether that should be considered reasonably available or not, I think is open to question. But I would say that, whether safe harbor adequately gets the job done is critically tied to, is the longitudinal quasi-identifier information available to the individuals who might be motivated to re-identify.
Okay.
Do you have any thoughts or comments to add to that? You've spent more time researching this.
Well, I think that you're right in that if the longitudinal variables can be reasonably available, for example, under a nosy neighbor attack that you described, then I think safe harbor can fall short. So it would be context dependent. Unfortunately, from what we've seen, it's easy to make the case in many data sets that we've seen that at least some of the longitudinal quasi-identifiers are knowable by a nosy neighbor, at least at a high level. Even things like diagnosis at a high level, level of cancer or cardiovascular disease. It's easy to make the argument that these are knowable fields. So, but you're right that it will depend on the specifics of the data set. The last question I wanted to ask you was about coming to the point about these query response systems where you run a query on a database and get a response, which was the last question we had from the audience. And I wanted to bring in differential privacy, which is a relatively recent privacy model that's been proposed, and it's become popular among the computer science academic community. What's your view on differential privacy and its practical application for the release of health information?
I think it's an idea with much promise, but I think there are, one, it tries to provide certain guarantees that I believe are perhaps not necessary to have as guarantees. One of the very important things is to make sure that the data is not degraded in terms of quality in the information that is revealed. And I think there's some real challenges in being able to have your cake and eat it too, that even differential privacy has a hard time getting around. In order to provide those privacy guarantees, I have questions about the extent of the data utility that is derived from those methods. I also have concerns about the computational effort involved in providing differential privacy solutions. When you're dealing with record sets that may have hundreds of thousands to tens of millions of records, it's challenging to see, at least with today's computing resources, how well differential privacy would work in those contexts.
Okay, great.
Do you have anything to add? I know you've studied that area as well.
Yeah, I think there's been little work on understanding the impact on data utility, on whether differential privacy distorts the data sufficiently or still produces useful data. I think that's still an open question, and until that question is answered, it's very hard to make statements of whether this is ready for prime time or not. But this is an active area of work, so hopefully some answers will be forthcoming soon. So that's kind of my view on this. So I think we've hit our time limit here. Did you have any closing remarks, Dan?
No. I guess my final comment would be that as an HIV epidemiologist, I have great concern that some of the attacks that are made on de-identified data for important reasons in terms of people's perception of privacy, they're made. But I want to put out there as a consideration that if we stop using de-identified data for important public health purposes, for example, and we were to miss the next emerging disease that starts to spread globally because of very minuscule privacy concerns that remain, I think that would truly be a tragedy. So I feel it's very important for us to take into consideration both the privacy protection that we get from de-identification, and yet at the same time pay careful attention to our ability to continue to use that data and to have accurate statistical analyses, because certainly bad science has a great deal of potential to damage people as well.